Okay, so that's this.
Fimbrium.
That's the red area.
Uterine tube.
Okay, so that's this, not this. Don't get confused.
Coming from the fin.
Yeah, so this is the ovarian ligament, right? This is a fallopian tube. That's an error, mistake that people make.
Can you call it the fallopian tube? Or
For me, that's the same thing, but I think fallopian tube is better.
yeah, it's easier.
More
to
common.
And that's how we've learned it.
More common, I think.
Yeah, that's what I've always.
But maybe I'm just old. Maybe young
No,
people.
it's always
Okay, all right.
old.
Well, it's true that old doctors use different names for things.
Ovarian ligament.
Okay, go. Tell me more.
Broad ligament.
Okay, so the broad ligament is basically covering this whole so it's everything covering like all this pink. There's supposed to be, it's like this pink layer where it's covering the whole uterus, and it's supposed to be covering, I mean, it should be covering like the whole ovary and everything.
Here, it included this too, right?
Yeah. Mhm.
Oh, okay.
So this is, yeah, it just sort of like covers this whole thing as the broad ligament. Okay.
Fundus.
And so the texture of it is like dense, fibrous connective tissue. It's strong. And let's stick to the ligaments. What are the other ligaments? So we said ovarian ligament, right? Holds this ovary in place. What other ligaments do we have?
Just those two.
Okay, I'm not going to let you leave this class without knowing some of the most important ligaments in your body. The round ligament, okay, which is here, okay? So the round ligament is holding the uterus in this flexed position. So if you look at, here's the vagina and here's the uterus, and it's a 90-degree angle. So for a probe that has to enter the uterus, I mean, if you're just putting a probe, or like let's say you're using a speculum and you're doing a pap smear and you use a speculum, I mean that's just a straight line into the vagina and up to the cervix. But for a probe to actually go into the uterus, it's got to be flexible or something, because it's got to make this 90-degree turn and go up. And what I don't know, there's something. Speaking of old doctors, something that an old doctor told me once. The most common and serious mistake that is made by non-professional termination of pregnancy is when you take a probe. So one of the techniques, right, is to take a probe and try to stick it into the uterus, irritate the lining of the uterus, cause the termination of the pregnancy, right? So the most common error, supposedly, according to an old midwife that told me this, was that they would take a knitting needle or a coat hanger and they'd look at the picture in your book, which is an anterior view, and in the anterior view it doesn't show that there's a 90-degree turn. So they just stick the coat hanger in here straight up and perforate the back of the vagina. And of course, the coat hanger is not sterile, and so then they'd introduce bacteria into the peritoneal cavity, and then you have peritonitis, and then you're dead. So, yeah, so that's sad. So, but those days may come again, so you should be warned and prepared. And
No babies.
understand that.
So maybe the message is not have babies.
Don't have intercourse.
Right, because
I was more afraid.
I think if that were to come again, there would be no birth control either.
Another bad reason for don't have babies.
I don't know about that, and I think it depends where you live.
Well, yeah, that's true.
Okay, so yeah, like if you live in Kansas, that's a different story. So Mississippi,
Why?
yeah.
They only have one clinic.
Explain me
Well, that's a whole I'm on camera. That's a whole political discussion that we will. I will tell you. I'll tell you about Kansas later.
Okay.
It's a interesting American story.
Okay.
There's a whole book about it called
interesting.
"What's the Matter with Kansas." It's a cool book. You should, good book.
States are the same.
Good book about Kansas. I love Kansas. So anyway, we got brown rod. Oh, and then you got suspensory ligament of the ovary, which hangs down here, and it goes. It's like not on this, but it's like in tandem with these gonadal. So here's your gonadal artery and your gonadal vein for female, right? And this is the right side, so it's going directly into the inferior vena cava, right? Okay, so it's coming out here. Anyway, so it should be like alongside that is this other ligament, suspensory ligament of the ovary. Okay. So what do we call it when all these ligaments are damaged?
Bad news.
don't have intercourse.
Yeah, it's when the
That's what we
uterus
call.
fell, right?
It's
when
called.
the uterus falls.
Yeah, the uterus falls down, so that's called prolapsed. Prolapsed uterus. Okay, and that's less common here in the United States because it's more common the more children that you have.
So having kids.
Well, the more you have kids, strains these ligaments.
Like in the old times, they have the ladies, they have grandmoms or great moms, they have like 9 or 10 babies. That kind
Right.
of people have that.
Yeah, so if you have multiple pregnancies, the more you have, the more risk you have for that.
Okay.
So, yeah. And so my wife, because she works with people who come from other countries, sees that a lot.
Wow.
Right. So her job is
Do they
specialized.
remove the uterus at that point, or can they?
Okay, so there's 3 treatments. Conventional treatment number 1 is surgical, attempt to repair the ligaments.
Okay.
So that's just taking sutures, maybe cutting out a piece of ligament and tying the 2 ends together.
That makes sense.
Okay, it's plumbing. I mean, it's basically just staple it together. Okay, then there's natural sort of old-timey treatment, which is called a pessary. And a pessary is like an insert. It's either plastic or ceramic that goes inside the vagina and actually holds the uterus in place.
Oh my gosh.
No.
Is that under general anesthesia, right?
Don't have any more babies. Well, no, because no, it's not. Supposedly not. It's supportive.
Okay.
It feels good, like a bra.
Okay.
It feels good. How do you know it feels good? How do you know it feels good?
And the third thing is hysterectomy, and it's very cultural and philosophical. So my wife, she comes from a very interventionist culture and perspective. So she's like, oh yeah, hysterectomy. Oh well, you're postmenopausal, hysterectomy. Get it out of there right away.
Right.
That's kind of just a. Culture, I don't know. It's not I don't think there's a right or wrong of which of these 3 approaches really. But that it's just sort of where she's coming from.
Right.
So. Okay, so those are the ligaments. Okay, you can continue.
Fundus of uterus.
So fundus is this part.
Is that the top?
The top.
The top.
Okay. Uterine cavity.
Okay, so let's look at the other. Let's look at
That's
that.
just the
Is it?
one side.
Okay, it could be this
Okay. Cervix.
here,
So it's specific.
but it's actually this whole area is the
Okay.
cervix.
Okay.
But normally, when we talk about cervical cancer, we're really talking about this epithelium on the outside here.
The cervix,
Okay.
right?
Yeah. Cervical canal.
So that would be like anywhere between there and there.
Okay. External OS.
So os means like mouth. So
Okay.
external mouth would be at this end. Internal mouth would be here.
Wait, where was the?
So external would be here.
Oh, okay.
Internal
Okay.
would be
What's the
there.
importance of that?
Endometrium.
External mouse?
Os. Well, so that is the area where you tend to get cervical cancer. So that's the area where they check. So when you're having the pap smear,
I know, I
put
thought
that. They put that probe in that looks. The probe usually looks something like this, right? And you stick this end into the os, and then you scrape around. The outside of the uterus looks. The shape is like that, right? So here's the external os. So you stick that in the os, and then you rub that around, and that's how you pick up tissue for the sample.
Oh.
And that may be painful if your cervix is friable, like if you smoke and don't eat enough vitamin C, and so forth.
Huh.
It feels
Don't get enough
weird.
folic acid. I'm sure, yeah. But for some women, it's super painful because their
So-
cervix is friable and unhealthy.
friable.
Interesting.
So what about the uterus that they are in retroversion? They are not in retroversion. They are in backwards.
It can hang. It can hang. Okay, so if this ligament is damaged, it can hang back this way. It can go up, right?
Yeah,
so
like
the
natural
what they call
labor.
retroflexed.
Yeah,
Retroflexed.
retroflexed. Thank
So
you.
yeah, and so that's like a unhealthy
Retroflexed.
position for it to be.
But suppose that, well, in my case, I born like that, so
Oh, really?
Well,
yeah,
I don't know. Then it's probably
it said like it's born like that.
Oh, you're probably fine.
you're probably fine. There's a
Yeah,
lot
they say
of
like I don't know.
there's a lot of normal variation.
Like, could
Yeah.
a baby move it around though?
Well, when you have a baby, I mean,
It's just gonna stretch
gonna
out
blow
so
up.
much that it doesn't
You know.
probably
Oh my
matter.
God, you think
But you
about
might be
that.
more at risk. Maybe you might be more at risk for a prolapse. Try not to have 8 kids. And if you do, have a good midwife who takes care of you.
But I mean, how is it? This is like a
So yours,
the reflection is like more
It will be
like
more
this way.
straight. It will be go more straight up,
like
up
a
like
90
that.
degrees.
It's
that
not.
up
It's
the
supposed
90
to be like this, 90
40
degrees.
40 degrees. Ah, no, that's
90 degrees,
okay.
right? So it could be like that, or it could be like that.
Like in
180.
180
hanging,
degrees.
hanging back too far. Yeah.
Okay.
so this is okay. The next ones are endometrium, myometrium, and periometrium. Is
Right,
that
right, uh-huh.
Okay. And corpus luteum.
I would no. Okay, so I would consider. So this is myometrium.
myo, and that's endo.
This is endometrium.
Right.
So this is trying to show like
Blood.
mid-cycle.
Right.
Yeah.
Okay, so it's so the so the endometrium here is really thick
Right.
on this
okay.
model.
And then
When
that's
it's
the
very thick, you have
myometrium.
endometriosis, right?
Endometriosis is where you have this tissue and it migrates to other parts of your body, like it might be over here.
Okay,
I
yeah.
didn't-
And then it bleeds every month, like inside your abdominal cavity.
And it's painful.
And it's painful, and you lose blood.
Yeah.
It's
I didn't
nasty.
really actually know what it was. I just knew it was painful.
Endometriosis is bad and strange
Yeah.
because it's sort of like, but this is kind of like stem cells or whatever because it'll float around and attach itself to other parts of your body where it's not supposed to be.
Corpus luteum.
Gluteus.
Did you know that your body is a monster? It's actually not your friend.
In fact, I know, we know that.
Do all sorts of
Hormones
weird things.
are traders.
Traitors.
Yeah, because
What's the corpus
you are,
luteum?
Okay, that's part of the ovary. So
you are not objective when you have your period, you know?
That like luteal phase.
Do you think you're objective and analytical, Luisa, when you have your period?
That's a myth. It's a myth. I took a whole class. It's a myth. Learned about it.
And what about you, Luisa? Are you?
I cry more when I'm about to have my period, but when I'm actually having my period, I'm pretty
Are you grumpy or sensitive?
I'm like,
a little bit, not very.
What about you?
I'm like, I took a class about this, and it was a really poor study that like first,
They
put
try
out
to help out
PMS.
women?
It was like some really bad study, and then scientists were like, oh, this isn't really true, but then the general public got a hold of it, and then they spread this whole myth of PMS. So I'm like, no, it's not
awesome.
true. It's not true. I'm trying to fight it.